I saw a post on Over It a while ago that I wanted to share here. A woman wrote up a post about what happens when you get a rape kit done. This is particular to the USA, her post is, but I found information about what happens in Canada, so I will share those as well. I will just timestamp in the description box below so you can go specifically to USA, Canada. Yeah. So on Over It, she posted in the Woman channel. The user is Red Mage. She titled the post, "I got raped. What happens now?" I'm a volunteer at a domestic violence and sexual assault center. One of the things I do is act as a sexual assault victim advocate as they receive a SANE exam, SANE, a rape kit exam. This means that I sit by the victim and provide emotional support and education and resources as they receive this exam. I posted about this and some of the comments made me feel sad as I think the SANE exam gets a bad rep. I'd like to talk more about what can happen after you get raped. So you got raped. This never should have happened to you, no matter where you were, what you were wearing, or what you consumed, no matter your past history with abuse, religion, dating, anything. I cannot possibly offer you the emotional support you need on this post, because offering what you need is impossible. I'm going to write about what resources are available to help you instead. You do not have to avail yourself to any or all of these resources. They are just a few that you're going to hear me push a little harder on because I think they have a very large reward with a very low risk of re-victimization. But even those are entirely optional. You can also break some of the resources in half and only partake in them partially. You weren't empowered during the rape, but you are now. You're the one who sets the course for this ship called your recovery, not anyone else. If that feels intimidating, don't worry. You have resources available with women with tons of knowledge to help you. You are at the helm, and us as your trusted advisors, we can sail out of this horrific storm. When you get raped and get out of the situation enough to be secure, you may or may not call 911. If you call 911, the police will come. This may or may not make you feel safer in that moment. The police may or may not be dickheads. Typically, the police I see on these calls are nice guys, but sometimes they say the wrong thing. Like they may bluntly ask, "Were you drinking?" To him, he's asking if you were in a weakened state, but to you, it can sound accusatory. If you call 911 and the police come, you can change your mind. You do not have to continue to help with the investigation. They may or may not leave at that point, but you can. The police may be able to give you a ride home. They may also stay with you until you get a ride. They may also stay with you until you're safe to drive. They may also drive you to the hospital. Any of these things are your choice, but they may be options that the police can offer you. Unless you are able to call the police with the rapist still there, they will probably not be able to arrest the rapist at that time. They have to gather evidence instead. Whether or not you call 911, you get help from a SANE clinic next. SANE stands for Sexual Assault Nurse Exam. A SANE clinic is a place that does SANE exams, but also does more. One of the first decisions you need to make is an odd one, whether to pee or not. Peeing gets rid of a lot of evidence. I suggest trying to hold it in, if you can, while you decide whether you want a SANE exam for the purpose of prosecuting. If you do want to try to press charges, try to hold your pee in as much as is safe and get over to us ASAP. If you already peed, it happens. We can still gather evidence. Sometimes the best evidence isn't even in that area. There's no way of knowing. If you want to criminally prosecute the rapist, you should get a SANE exam. The SANE exam is like a gynecological exam without a pap smear. The nurse will collect evidence like semen, pubic hair, and saliva from your body. The nurse will also record bruises, bite marks, and any other wounds to also use as evidence. The nurse can also administer treatment to those wounds. If you don't want to criminally prosecute the rapist, but you're worried about medical things, the nurse can still give you an exam. A common thing victims want is confirmation that their IUD is still in place. The nurse can take a peek and make sure. You can ask for a full SANE exam, but not have the evidence released to police. It'll sit safe in a storage facility in case you change your mind. You can ask for a partial SANE exam. For example, you might want her to peek at the IUD, but not want pictures taken of the strangulation marks. Or maybe you only want to be screened for strangulation and gather any evidence that can be gathered without taking your clothes off. You are the director of what services the SANE nurse provides. A SANE clinic also offers some resources outside of the SANE exam: a place to shower, a change of clothes, connection to other resources like free therapy. And here's the big one to me. I shouldn't ever try to encourage a victim to do one thing or another. It is absolutely true that you are at the helm, but I'm going to falter and do so in this one regard: STD prevention pills. There are medicines that if you take it very soon after exposure to an STD, that it can prevent you from getting that STD. SANE clinics have these drugs and are happy to give them to you, typically for free. If you don't want anything else, it is totally okay to walk into the SANE clinic and say, "I was raped, please give me the drugs," and then leave. We will be so happy that you trusted us and that we were able to help you in some small way. Once you have or have not called 911 or have not gotten a SANE exam, take a shower and sleep in. There's nothing more that's effective on the day of. The next day, you can call your local domestic violence or sexual assault resource center and ask for resources for therapy. It's very likely that they'll have free group therapy. It is likely that they also have free individual therapy, but there's also likely a wait list. Your domestic violence or sexual assault resource center can also connect you to a victim advocate. This is likely a different victim advocate than the one you may have had to deal with at the SANE clinic, just because there's more general victim advocates than sexual assault victim advocates. She's not a therapist, but you can talk to her about what happened. It may help you process what happened. She may be able to tell you things about trauma that help you. For example, many victims are upset that they don't remember the events well, but that's super normal. We even have a list of things that are normal trauma reactions, just so you know. You're already stressed enough. No need to add unnecessary stuff on top of that. From there, you should be connected with the people who can help you on whatever journey you choose to embark on in your recovery. Connected to the police if you're pushing charges, connected with the nurse for medical concerns, connected to a therapist for psychological concerns, and connected to a victim advocate for anything else that comes up. I'm so sorry that this happened to you. You can heal from this and be okay. It will not happen fast, but it certainly can happen. You can have a team of experts, many of whom are also victims themselves, to help you. That is particular to the United States, and I will link to the SANE information and SANE clinics. We're now going to move on to the Canada-specific sexual assault evidence kit process. It's from a website called misinformed.ca, everything you need to know about sexual assault evidence kits. This post outlines the general process of having a rape kit completed, formerly known as a sexual assault evidence kit, SAKE, in Canada. The process may vary slightly from patient to patient since all sexual assaults are different for each individual. The sexual assault nurse examiner, SANE, will tailor the examinations to your specific individual needs. For example, the examiner may take swabs from areas of your body that are not listed in this post, but are areas that may hold DNA evidence from the assault. For example, breasts, neck, etc. If you find that your experience in having a SAKE done does not follow these general steps, please contact a local sexual assault agency for support and advocacy during this process. If you have been sexually assaulted, you do not need to get a SAKE done. As a survivor of sexual assault, the following choices are available to you. You can have a SAKE completed and have the kit submitted to the police. You can have the SAKE completed and choose not to submit the kit to the police. You do not have a SAKE completed and you move forward with reporting the sexual assault to the police. You do not have a SAKE completed and you do not report the sexual assault to the police. A note, if you already reported the sexual assault to police and complete a SAKE, it must be submitted to police as evidence. If you do not want to submit the SAKE after reporting the sexual assault to the police, you may decide to withdraw your report of sexual assault. Okay, so what is a sexual assault evidence kit? A sexual assault evidence kit, SAKE, or rape kit, is a box of medical examination tools used to collect DNA information from the human body for the purpose of forensic analyses. The content of a SAKE includes an instruction sheet and checklist for the nurse examiner to follow, documentation form, tubes and containers for samples, paper bags, swabs, a disposable drop cloth, a comb, wooden sticks, labeled envelopes, and boxes. Why have a sexual assault evidence completed? The SAIC's purpose is to collect forensic evidence to use in police investigations into a sexual assault report. If you report sexual assault to police within 12 days of the assault, the police will most likely suggest having a SAIC completed at a local hospital. Evidence from a SAIC is often one of the only pieces of scientific evidence available that can corroborate a survivor's report of sexual assault. However, it is not required to complete a SAIC to report sexual assault. Who administers a sexual assault evidence kit? Hospitals across Canada have sexual assault nurse examiners, SANEs, that are specialized in working with survivors of sexual assault, domestic violence, and intimate partner violence. These nurses are specially trained to administer SAICs in a safe, trauma-informed manner. If you decide to have a SAIC completed, you have the option to choose a male-identified or female-identified nurse examiner. However, most SANEs are female-identified. You may also choose to have a friend, family member, or advocate present during the SAIC examination. When should I get a sexual assault evidence kit completed? While it is recommended SAICs are done as soon after the sexual assault as possible, that may not be the best option for the survivor. The best chance to collect biological evidence is up to 72 hours, 3 days, after the sexual assault. However, there may be some evidence available up to 12 days later. After 12 days, a SAIC cannot be administered, as the physical evidence on the survivor's body is no longer present. For an ideal SAIC examination and ultimately the most accurate results, it is recommended a survivor does not shower, urinate, defecate, or use a douching product after the assault. This is to preserve as much of the perpetrator's DNA evidence until it is collected during the examination. However, please do what feels right for your body and your physical and emotional needs. Evidence may still be collected even if you do shower, urinate, defecate, or use a douching product after the assault. How long does a sexual assault evidence kit take to complete? It can take between 1 to 8 hours for a SAIC to be administered. The length of time depends on the survivor's sexual assault experience, presence of injuries, if the survivor would like to take breaks during the process, and how much of the kit is administered. Survivors may choose to have certain parts of the kit done and not others. For example, a survivor may consent to have an oral swab done, but not a vaginal or penile swab. If the full SAIC is not administered, it will take less time to complete. The SAIC may take longer to complete if the examiner asks to take swabs of additional areas of the body. Depending on the details of the sexual assault, additional swabs may be taken. For example, if the perpetrator touched the survivor's shoulder, the nurse would ask to take a skin swab of that specific area. Where do I get a sexual assault evidence kit completed? You can have a SAIC completed at your local emergency hospital. You may show up by yourself with a friend or family member, an advocate, or a police officer. Depending on your location, the hospital may have a sexual assault or domestic violence care center where the SAIC can be completed. In addition to administering SAICs, these centers provide emergency services, follow-up supports, referrals to sexual assault centers, and counseling for survivors of sexual assault, domestic violence, and intimate partner violence. The step-by-step process of a sexual assault evidence kit. Step 1. Arrive at the hospital. Once you arrive at the hospital, you will be guided to a private waiting room or exam room right away. This is to protect your privacy, foster safety, and build rapport with the examiner, the SANE, or nurse. Step 2. Description of the sexual assault. Before the SAIC is administered, the nurse will ask you to provide details of the sexual assault. The purpose of providing an account of the assault is to help the examiner tailor the SAIC to your individual experiences. Since the SAIC is used as forensic evidence in police investigations, the examiner will want to make sure they are collecting the perpetrator's DNA evidence from your body. It also helps the examiner determine which parts of the SAIC are most important to do first, which can be helpful if the patient does not want to stay long. Step 3. Providing consent. The nurse will ask for your consent to administer the SAIC. There are multiple components to the SAIC, and the examiner will ask for your consent before administering each component. The consent process during a SAIC examination is ongoing, and your consent can be withdrawn at any point. You may stop or take a break at any time during the examination, and the nurse will continuously remind you of that to ensure you are comfortable. Step 4, undressing. After consenting to the sake, you will be asked to undress on a disposable drop cloth. The drop cloth is meant to collect hair or other physical evidence from one's clothing or body. The examiner will give you a hospital gown to wear for the duration of the examination. Step 4A, collecting clothing. The examiner may ask to collect your clothing, including underwear, to use for evidence. This is only the case if the clothing was worn during or immediately after the sexual assault. If you consent to giving your clothing as evidence, the examiner will put each piece of clothing into a separate paper bag. It will be labeled as evidence and given to the police with the sake, if you have decided to submit the sake to police. If you did not bring a second set of clothes to wear home, you will be provided with additional apparel at the end of your appointment. Step 5. Physical assessment for injuries. Once you have changed into the gown, you will be asked to sit on the exam bed as the examiner assesses your body for injuries or soreness. Injuries, for example scratches, tearing, bruising, etc., may be photographed as evidence with your consent. Any injuries or soreness will be noted on a documentation form included in the sake. During this assessment, the examiner may ask to take samples from your body, such as fingernail scrapings using the wooden sticks, urine, blood if alcohol or drugs were involved, head hair, additional swabs. Taking these samples will depend on the description of the sexual assault that you provide to the nurse before the examination, as the examiner will collect samples from your body according to what you have shared. Step 6. Swabbing. After the physical assessment, the examiner will ask to take oral and cheek swabs. The oral swabs are used to identify the perpetrator's body fluids that may still be in the mouth. The cheek swabs are meant to collect your DNA to allow forensics to differentiate between your DNA and the perpetrator's DNA. Next, the examiner will ask you to lie down on the exam table and put your feet in stirrups for the next swabbing component of the sake, if you consent. The purpose of swabbing is to collect the perpetrator's bodily fluids, for example semen, sweat, blood, etc., that may be left on the survivor's body. The examiner will swab the following, if applicable: external genitalia, vaginal and cervical area, penis and scrotum area, rectal area. Note: rectal swabs will only be taken if rectal sexual assault is reported. They will not be collected for survivors under 18 years old. At each step of the process, the examiner will ask you for your consent and will detail each move to ensure your comfortability and emotional well-being. Step 7. Pubic combing. The examiner will ask if they can comb your pubic hair to collect the perpetrator's hair or DNA. The examiner will carefully brush through your pubic hair and put the collected hair in an envelope. The examiner will gently cut pieces of your own pubic hair to use as a DNA standard. This allows forensic analysts to determine what hair belongs to you and what hair belongs to the perpetrator. If you do not have pubic hair, a swab may be taken from your pubic area. Step 8. End of examination. After the examination is complete, the examiner will ask you to redress. All biological evidence collected during the exam will be put in the sake box and labeled with your name. Step 9. Debrief. The examiner will sit with you, along with anyone who has been present throughout the examination, such as a friend, advocate, family member, etc., to discuss next steps. The examiner may suggest taking antibiotics to prevent sexually transmitted infections and/or offer emergency contraceptives to prevent pregnancy. It is your choice to accept or refuse this medication. If an advocate is present, they will provide resources that you can access as a survivor of sexual assault. These resources include counseling, emotional support, and healthcare options. If no advocate is present, the examiner will go over these options with you. What happens to the sexual assault evidence kit after it is completed? It is your choice whether or not the sake is submitted to police. However, if you have already reported the sexual assault to police, it must be provided as evidence. Not releasing the sake to police after making a sexual assault report is considered withholding evidence in an investigation. You can decide not to proceed with the case after making the report, and at this point you do not have to submit the sake to police. If you do not proceed with the case or the case is unsolved, The kit will be kept by the hospital indefinitely. If you report sexual assault to police after having the SAIC done, it will be submitted to police as evidence. You will be notified when this occurs. If you have not reported the sexual assault to police, then it is not required to submit the SAIC to police. If you choose not to submit the SAIC to police after completing the SAIC, the kit may be kept at the hospital for up to 6 months. After this period, the SAIC is destroyed by the hospital. The SAIC will not be accessed or tested without your consent, even when it is submitted to the police. So those were the 2 posts I found regarding sexual assault evidence kits and the practices that happen in the USA and Canada when getting one of these examinations done. I hope it was helpful. I hope it might offer someone some comfort if they ever need to pursue one of these examinations. And as mentioned, the links to both of these things will be in the description box below. Thanks. Bye.